name's Andrew Thompson. I work within the finance industry and have done for quite a few years. I suffer with a condition called Best's disease, or vitelliform macular dystrophy, which falls under the category of macular degeneration, and within that, which has wet and dry form, it's what we refer to as the dry form. As it's a dystrophy, that means it's hereditary, so my father also had it, and unfortunately I've also passed it on to my daughter. But therefore it can sort of impact at sort of quite an early age, and it sort of first was picked up when I was about 9 or 10. Well, basically it's the macula, which is the sort of the bit that everyone needs to see sort of pinpoint vision. That has a huge number of sort of cells within it. I think it's something like 12,000 cells or something within a sort of 5 millimetre sort of area. And the macula basically has a sort of a build-up of fluid between all the layers, between the back of the eye, and that pushes it all out of sync. I'm talking real layman's terms. Obviously, I'm not an optician or a specialist in this area, but my understanding is that the build-up of fluid pushes everything out of order, and in some instances, the actual fluid or the blood will actually seep through into the eye. Now that will then become the wet form of macular degeneration. In my case, it doesn't seep through, but it just distorts everything. So what happens is there are areas there which do get damaged in the scar tissue, and that prevents getting pinpoint vision. So my central vision is not good. So say, for example, if I'm looking at you, your face is just a blur, and sort of, if we had a staring competition, I would win. But all around you is perfect, because the vision, the surrounding area, which, believe it or not, the surrounding area has the same number of cells. So you've got a much bigger area, but with it's not as sort of pinpoint. But I use the peripheral vision to sort of get around, and you see it. I'm not sure what other people with macular degeneration actually see, because obviously we all see things differently. But in my case, you see it on the news where it's described as a big black blob in the central vision. In actual fact, it's not like that. It sort of takes on the colour, if you like, of the surroundings. So you don't see it as a big black blob. You just see it as very, very out of focus, almost as if you've put sort of Vaseline on your glasses and sort of trying to look through a blob of Vaseline, whereas everything else surrounding it is perfectly clear. So, for example, if I was looking at a tree, you'd just see it as a green tree, and as long as you weren't looking at the detail and you glanced at it, it would just look normal. So, that's how you sort of get by with it. It sort of manifests itself in different ways, but that's effectively what I see.
Okay, I'm Bill Gardner. I'm 72. 14 years ago, I was diagnosed as having dry macular disease in one of my eyes. And there are two kinds of macular disease. One is dry and one is wet. Dry macular means that the point at the back of your eye, where all the light is focused that you take in, is a tiny pinprick of light. And the point that hits the back of your eye wears out, many specialists say, wears out rather like a carpet does. And so all of the receptors that normally turn that into normal vision become dulled. And macular degeneration, as I understood it then, meant that it was a very slowly progressing disease. It affects people mostly in the age of over 55. It then progresses very slowly, and you can be lucky, if there's such a thing, you can be lucky and get all the way to death without having your vision seriously affected. You can be unlucky and have it affected in a few years and then get progressively worse. That's what I had in 14 years ago. And there was no effect, particularly on my life, because my vision was very good. I was just in the early stages. And then 2 years ago, in a routine examination, I was told that my right eye had gone wet. And that's for many patients what the dry form progresses to be wet, and that's in many ways much worse. Firstly, it progresses much faster. It produces a macular spot, it's called, in the center of your vision, which means you can't recognize things that you're looking straight at, but your peripheral vision can remain relatively unaffected. But the wet macula is caused by blood leaking into the back of the eye from the blood vessels in the eye. And what I didn't know then, and we only found out from a lecture at the Macular Society a few months ago, blood inside a blood vessel or an artery is in its perfectly normal place and is good for the body. Once a blood vessel bursts and that blood is allowed to leak into places where it doesn't live, it becomes caustic, and it produces scar tissue in the back of the eye. Therefore, if you have wet macula and the back of the eye bleeds, which they all do, the effect on that is that you have very seriously blurred vision in a central spot. The people concerned don't want to let on that they can't see very well. So they will do anything, generally, they'll do anything to appear normal. So it's very difficult for the public to spot it. But the signs are there sometimes. But blind people and sight-compromised people can be very defensive. But I think if any member of the public is aware that if they offer help, like can I read these things on the supermarket, that the blind person or the sight-compromised person, if they react a bit defensively or aggressively to say, no, I'm fine, not to take that as an insult, but just to accept that those people are hurting, and that's why they're responding like that. And that's no reason why they shouldn't try it again next time they see somebody who might need a little bit of help. The statistics are approximately 1 in 5 people over 60 will have macular degeneration. That goes down to 1 in 3 people over 80. So in the population of Guernsey, you'll have perhaps 1,000 people who are suffering from the condition. And as we get an aging population, that is going to increase, not decrease.
Up to the last 2 or 3 years, it hasn't had a huge impact on me. I have been driving sort of for 34 years, but I've had to stop that now because I can't see the number plate. So, you know, that's I can see the number plate, I just can't read it, which is obviously the main focus. Obviously, a couple of years ago, I went into the optician, drove down to the opticians, sort of went through the normal tests, at the end of which they said, are you still driving? I said, yep. And they said, we don't think you should be. So I took it upon myself to take myself off the road. So that was June, July 2015. And so basically just cycle. So that's the first thing that because you know, when you've got some sort of disability, it's the fact that you're losing your independence. That's what concerns many people. And so whatever you can do to sort of maintain that level of independence obviously keeps you positive. So the day after we've got 2 young children, so that would put more onus on my wife having to do the school run. So I went straight out and bought a tag-along. So I was able to at least help with running one of the children to school. At that time, they were going to different schools. That helped. But so that's the first challenge. But again, there's positives with that. I get to work, 20 minutes, rain, shine, wind, whatever. It's all traffic. It's just going to take me 20 minutes. I feel I'm a lot healthier than I was. So, well, bodily wise, not eyes wise, obviously. One of the big issue that I've had for a long while is actually facial recognition. As I mentioned earlier, you know, sitting here, we're 2 meters away from each other, And if I look directly at you, I just lose all your facial features. And so when you're walking in the street, the number of people I've walked past, and of course they just assume you've blanked them, and you know you're not doing it to be rude. And the number of times I've done that to my wife is, you know, but she keeps changing her hairstyle, so it's like those, you know, the aircraft recognition things, the silhouettes of the aircraft recognition. You know, you recognise people by their hairstyle sometimes, and if they change it, you've had no hope.
One of the things you have to remember about macular disease is that appearances can be deceptive. So you can see a person walking through the supermarket and you would never know that they can't see very well, because they've got peripheral vision, so they can see to walk down the aisleways, and they can see at a distance some of the product ranges they want, well, be it cereals or baked beans, but up close they struggle. And they have to get up close to read the stuff on the packet that they want to read. And there's the dilemma. So you can appear to be quite normal, but not be quite normal. And the giveaway, of course, is when you see in a supermarket, you see somebody with their nose 2 inches from a tin of baked beans, desperately trying to find an area of their eye which can read the small print that they're looking for. And when you see, and there are lots of examples like that. If they want to read the newspaper, for example, they can either say, well, I can't read the newspaper anymore, or they can say, I can't read the newspaper in the way I used to read the newspaper, so I need a device, a something, be it electronic or mechanical, a magnifying glass, a computer screen, something that blows that print up and allows me to read it. And there are a million examples like that from every day. Needlework for women, hobby work for men, books, watching television. How do you watch television if you've got to sit a long way away from it in order to get it in your peripheral vision, but that's too far away to see the detail? Everyday things that are really difficult are restaurants. You'll probably have noticed in the last 20 years, or I've noticed, in the last 20 years, the writing on the menus gets smaller and the light gets less. So they dim the light, and you're trying to read a menu in dim light. Now, the one thing that a macular person needs absolutely is the best light possible to have even a chance. And you'll see in restaurants these days, you'll see people with their iPhone set onto the spotlight, and they read the menu by running their iPhone over the menu card. And it'd be nice if places began to become aware that not just macular people, but a lot of elderly people have slightly compromised eyesight, and dimming the lights and printing the menu with blue on white, pale blue on white paper is only going to be visible to people with wonderful eyesight. So those are some of the everyday things that can be frustrating, but are relatively easy to put right.
Within work have been brilliant. They've provided me with a dual screen, so within that I can then sort of do the work that I have done all my life. There are loads of applications now that assist people. Within work have paid for a specialist application that actually reads the text on a computer. But having said that, there is actually also a sort of the similar type of application already within many computers that people are just unaware of. I'm talking about a PC rather than a Mac at the moment because that's what I use. But if you use the Windows key and the letter U, it brings up a whole load of applications which will read the text, magnify the screen, and so you've got all these sort of things these days that will assist you with these sort of problems. So what I tend to do at work, one of the screens has it standard size, and on the other one I use it with the magnification. I do have to do that because when I have to explain things on the computer to my colleagues, if they look at the magnification one, they start feeling seasick. So they're better to sort of focus on the more stable screen. But again, you know, it's sort of finding ways and means to sort of get around things, and thankfully that assists me, and I can sort of still do the job that I've been doing. Mind you, I've been doing it for 30 years, so you know, I've got a vague idea.
And do you tend to tell people, or is it something that might just come up naturally?
I think these days I tell people more, basically because, you know, people will hand me something to read, and I say, oh, sorry, I can't see that. Just a second, and I'll take my phone out, photograph it, enlarge it, and then I can read it. So, you know, there's ways and means of sort of getting around, and I think from my perspective it's just having the front to sort of say, look, I've got a problem, don't worry about it, I can get by doing this sort of thing. And of course, you know, if you look at things within just general shopping, for example, there are, you know, sometimes there's the print on some of the smaller products, you know, there are some that are the style of the labelling is sort of a handwriting, and I've got no hope with that. But if I photograph it, enlarge it, then I can read it. That might look quite odd to the people in the supermarket, but, you know, hey ho, just sort of it's how you deal with it.
I think it's very difficult for anybody to understand the impact that any disease has on somebody that has it. If you don't have diabetes, how would you know how a diabetic is affected by everyday life? If you don't have cancer, how do you know how a cancer patient feels who is in remission but doesn't know when or if the disease will come back? I think people simply can't identify what it is that affects somebody that has an eye condition, particularly if it's a progressive eye condition like we have. The way you can achieve that is by more publicity concerning the conditions, such as you're doing now, just to bring it more to the attention of Joe Public, so they can begin to recognise that the person with their nose an inch from the baked beans tin might have the need of some help. And wouldn't it be nice if you saw that in the supermarket and somebody went across and said, if you're struggling, can I give you a hand for 5 minutes? We'll walk around and do some of the shopping. We created a group called Guernsey Macula Society for all of those people who've got the condition to come and mix with other people who've got the same condition and learn how to deal with it. So I've listened to lots of them talking about things they have to deal with, things they struggle with, things that affect their psyche and get them depressed, things that frighten them. And we've, in that group, which meets once a month, we've tried to find ways of having visiting speakers come in to talk about motivational stuff, attitudes, blind people coming in to talk about ways in which they cope. And the evidence is there, after running this for 2 years, the evidence is there that if you keep a positive note going through everything, some of those people, or all of them, can start to feel better and can start to feel more ambitious about what they might or might not try to achieve.